Hi, and welcome back to Unmasking the Trans Movement with John Euler. I'm your host, Brad Wilder. Today we return for part 2 as John Euler, Dr. Ann Gillies, and Dr. Jay Allen sit down to complete the talk that, well, has a lot of lies in it. Not from our guests, not from our hosts, but rather from the medical profession in general. Let's bring them all in right now. It's going to be a second half that's going to be filled with a bunch of information that is really going to help parents understand whether they should take their kids to a therapist or whether they should maybe even think about dealing with this topic all on their own. Let's bring in John, Dr. Ann, and Dr. Jade. John, let's start with you real quick. Kick this off. Do you think parents should still take their children to see a therapist that is conversion therapy related if the kid is confused?
I think they need to find a therapist that can objectively help. And when we're dealing with kids, people need to understand that kids, the younger the kid is, the less the child understands themselves. So they need a specially trained therapist that can help a child figure that out. Adlerian therapy is the basis of a lot of child or school psychology, where they will elicit from the child, because children can be confused. For teenagers and pre-adolescents, they are still in that identity formation. And that's why we are against those that would unduly influence kids. They need help figuring out what they believe and why. They need help to explore their confusion, plus their adolescence. We all remember what it was like being teenagers. So to take a kid and suggest a course of action that will have lifelong implications and repercussions is, in my estimation, it is certainly unethical, if not immoral, and it should be illegal. But here we find ourselves now on this program trying to unweave language that has been capitalized upon and twisted to where those that would suggest, those of us that I believe are responsible, that we want to help young people find their true self and their true identity, without undue influence. Now it's being flipped around that if you somehow help a child maybe wait to make radical decisions in their lives, that is somehow being called unduly influencing. That is not. That's empowering a child. It's informing a child. They need information so they can make informed consent. Dr. Gillies and Dr. Allen, thank you for being back. We're going to go through your article that you've just written, but Dr. Ann Gillies, you have written and have some resources on this. You're in Canada, and that's why we want the Canadian government to know we're not anti-anything. We are pro the protection of women and children and for fully informed consent. So speak to Dr. Ann, and then we'll have Dr. Allen continue with his article. Speak to how you have addressed this issue in Canada.
Well, it's interesting, John, because when you talk about informed consent, I talked in the last show that a child cannot adequately make informed consent. And something that was going through my mind, and maybe Dr. Allen can speak to this after, was here we have children of all different ages, all different backgrounds, all different experiences, and they are all being treated in an identical manner. Something should be suspicious about that. We put them on puberty blockers, we put them on hormones, and then we do surgery. And of course, that's not even talking about all the ramifications from those things, but just the whole thing of how do we do that? We start with a 10-year-old and we put them through the same thing that we put a 15-year-old through. And, there's just a lot of questions. But actually, John, I'm going to share my screen if you like. And I'll just bring this up. I'm making a rack card just to talk a little bit about the dangers of affirming gender ideology. And I just completed a book called Ultimate Deception, The Dangers of Gender Affirmation Therapy, and it will be out in September. So I just took a couple things here. It's just really simple because I don't want people to feel so confused. But gender dysphoria is a form of psychological distress. These children, we talked about this, Dr. Allen, last time, suffer from multiple pre-existing mental health concerns. Here's some stats. In 2014, 0.6% prevalence of gender identity disorder. See, this is also part of the language change. There's only 0.6% of the population in the US who have had a diagnosis of gender identity disorder. Jump forward to 2021, and we have it now as high as 1 in 100 children between the ages of 6 and 17 who are now claiming they are gender dysphoric. And that's, the terminology's changed to be more encompassing of children and adolescents who are distressed about, the changes in their body, puberty coming up. There's a lot of angst over puberty. And so now we are seeing this astronomical rise. There's multiple risk factors that are not being recognized for these children. And we just briefly talked about them, but insecure, disorganized attachment, which I love to talk about, and trauma, unresolved loss. Those two things themselves, left unidentified, create lifelong mental health issues. And then, of course, you have under that kind of conflict, loss of family cohesion through divorce, separation, multiple partners. That's very upsetting to children, and exposure to multiple childhood adversities. One thing that has come to light, and I don't have the references on this rack card, I'll put them in a QR code, but these are referenced. So there's studies. This says that neither hormones nor surgeries have shown to reduce suicidality in the long term. And that is a repetitive study. It has been, there's several studies that show the exact same thing. And then affirming a child's misguided sense of self runs the risk of neglecting the pre-existing mental health problems. And that's what we're seeing. We're seeing these children who now are in their 20s and 30s coming to the end of themselves, so to speak, and going, if I had just dealt with the other issues, I wouldn't have had all of these surgeries. I wouldn't be a null. I wouldn't have this inability to even have sex, or to have an orgasm, all of these things. And it's so, so sad to hear detransitioners talk about the losses. Vulnerable children. So I want people to understand this. Vulnerable children such as these, with all the risk factors that I've talked about, these are vulnerable children. They're much more likely to fall prey to sex trafficking and pedophiles. And this is not being discussed. And one of the things that the conversion therapy ban has suppressed is this very discussion. So I'm really happy we're having that discussion today. I'll stop this share. Those are just a few points. But I know, Dr. Allen, you can elaborate on most of those things. So yeah, let's continue our discussion.
Okay. So following up on something that you said, the indiscriminate treatment and improper treatment. So that's one of the things that goes along with conversion therapy. It's a one size fits all. And the problem is that one size doesn't fit all. I mean, before this whole transgender craze started up, when you were talking about the small cohorts of young boys or older men, they used to go through psychotherapy to determine what the underlying issues were and the best treatment option for that individual patient. Well, the recommendation for psychotherapy still exists, but it's largely ignored. It's not uncommon for someone to go in, have a 20-minute conversation with a LPN or an RN, and go home with a prescription for puberty blockers, which is crazy. You know,
Can I ask you something?
Sure.
Are RNs allowed to diagnose in the U.S.? I thought only
maybe it's a psychotherapist. I'm not sure who they're talking.
Well, but I'm just wondering. I don't doubt that they're diagnosing. I don't doubt it, because teachers are diagnosing children in our country. They tell the child there must be transgender.
Physician assistants. Yeah, I guess it depends upon what the governing entity, as far as the state or the province. But you can have physician assistants that can prescribe, and there may be a state there that I'm not aware of where you can prescribe it. It certainly is being taken out of the doctor's hands.
Yes.
More and more people can prescribe now.
Yeah.
And I was just questioning that because I don't doubt it's happening.
Yeah. But anyhow, you know, the treatment for these other conditions is not gender affirming care. It's, you know, it's antidepressants, it's anxiolytics, it's psychotherapy, and yet they say, well, we'll treat for the gender dysphoria and these other issues will go away. Because in the minds of the gender ideologues, the depression, the anxiety, the PTSD all comes from what they call minority stress. In other words, belonging to a oppressed minority, in other words, transgender people. Whereas, you know, you mentioned this in the last episode, these are conditions that existed before the transgender identification. And a lot of times these conditions existed years before, 4 or 5 years before any thought of transgender identification. And so they're missing out on the appropriate treatment for this one-size-fits-all type of treatment. And that's consistent with conversion therapy.
Another question?
Yes.
What about the parents? Like, what do you know about mental health with the parents of the child? Is that ever identified? What have you seen?
Well, there is a component of Munchausen's by proxy. So you'll see that, and I can't remember where I read this, but one of the clinicians talked about a mother who brought her child in, and it was clear that the mother was instructing her child what to say so that the child would be identified as transgender. So that was one case. And we don't know how often that happens because they don't pursue that possible diagnosis. They just assume that the kid is transgender and proceed with treatment.
Dr. Allen, we even see, I mean, it was public that Jazz Jennings at his age biologically, right, XY chromosome, right, is caught telling someone, I don't feel like myself, and the mother is comes to the rescue, so to speak. Oh no, you, right? So reinforcing this false identity. So no wonder Jazz, you can see one look at Jazz, and guess what? All the eating is about. It's suppressing truth that's trying to come up, suppressing intrapsychic pain. And so the last thing Jazz needs is for a mother to come along and say, no, we know what you are.
Yeah. Yeah, and we also see this in families where there's 3 or 4 children, and every one of those children has some sort of transgender identity, non-binary, transsexual, asexual, every single one of them. And you know that's not endemic, that's not a natural state. To see 3 or 4 children in one family, you know it's coming from the parents or someone inside the family.
That's really interesting. I hadn't read much about that, Dr. Allen, but I did read I think it was 1993. It's an older study that identified, get this, that 53% of the, children being diagnosed with gender identity disorder, 53% of them had mothers that were not bipolar, borderline personality disordered.
Yeah.
That's a huge percentage. So 53% of these mothers had borderline personality, which, as you know, John, is incredibly difficult to treat. And
that's the crazy making personality disorder, right? The hot and cold back forth and talk about how to screw a kid up.
But nobody talks about this. So think about the trauma this child is in, and how they must feel if they don't go along with what mommy wants. Like if mommy wants a girl and it's a little boy, like this is really, really concerning stuff, and yet it's not being talked about.
Yeah. Well, the other thing we're seeing too is that we're starting to see mostly progressives, and this seems to be most common among liberal white progressives. But what we see is that they will raise their child as an agender. So they will know the sex of the child because they're changing diapers and stuff. But they won't tell anyone, not even grandparents, the sex of the child. They'll give them, names that are either male or female. And this trend is called theybies, because they're raised as non-binary, and they're letting them choose their own gender at the age of 2 or 3. And there's one video I watched where this woman she's got I think it was an 18-month-old or a 2-year-old, and she's asking him or her, I don't know which sex it was, but she says, "Are you a girl? Are you a boy?" and she gets a slightly different response with each, and so she says, "Oh, you're a boy." So
well, I guess it's crazy making for the child. But the other thing is, I guess grandparents aren't doing sleepovers with their grandchildren because they're not allowed to know what sex it is, so you can't change the diaper. I mean, think of all the ramifications of doing something like that, hiding the sex. I'll call it sex instead of gender, because gender is really just a way of expressing our sexuality in a sense. But grandparents aren't allowed to have that quality time with their grandchildren. They can't be if they're hiding it from the grandparents. And there's something going on here, aren't there?
Right. This is so cult-like. It really is despicable. There is no other way to think that you're going to take a perfectly normal child and begin to confuse them by not providing fact-based information, something as simple as you're a boy or you're a girl, so that they can ground the child in reality. And then what do you do with puppies and kitties? What are you going to say? Those are all gender neutral? How about a rooster and a chicken? Who lays the eggs? What do you do with these poor kids? Talk about screwing these kids up.
Well, come to my farm.
What, right? Political correctors and people that want to manipulate. So, mommy, where do babies come from? So we're just screwing these kids up mentally and emotionally. It's abhorrent. And it makes them easy for predators, easy target for mental manipulation by financial and medical and sexual predators. It's as simple as that.
Well, I think what you touched on, John, is really, when you think about that, what we applaud as being a wonderful care for children is actually child abuse.
Okay, so a child has a dog, a child has a puppy. Well, dogs love to have belly rubs. Well, let me see here. Last time I checked, our dog, if it rolls on its back, it's pretty evident Stanley's a boy. So what do you tell a young child when they see a male dog's penis? It's right there. That's going to be a topic of, that's going to be a question. And so what do these woke parents do? What are we assigning this dog? Maybe I should ask Stanley the dog whether he feels he's a male or female. So, this is cult-like mental and emotional manipulation. But Dr. Allen, continue, because you wrote an article, right? Gender affirming care is conversion therapy. As a matter of fact, I'll bring that up so people can see. They can access that. It's on the main wire, which you are from the state of Maine, so they can go and read this. You're kind of going through an outline of what you covered in there because you became concerned as a physician that you started to see, wait a second, this push now, gender affirming care is euphemistic to say we're fast tracking kids into sterilization and amputation. We're sending them down a certain path real fast, and is going to change them permanently. That's the working definition of conversion. And you were working through and continue now with how you are really unpacking this term, finding that gender affirming care is the new conversion therapy.
Yeah. So this was brought up earlier, but I wanted to go into more detail about this. So conversion therapy often relies on uninformed consent or inadequate consent, inadequately informed consent. So there are several aspects to informed consent. You have to talk about the risks and benefits of the procedure you're recommending or treatment you're recommending. You have to talk about alternative treatments, including no treatment. And then, I guess it's those two things. But anyhow, in terms of harms and benefits, the gender ideologues will exaggerate the benefits and minimize the harms. So you're not getting a true picture of what can happen to your child if you go through and proceed with treatment. The other thing is that I lost my train of thought. Oh yeah, the gender affirming therapy is recommended as the only therapy that's admissible. If you ask about the watchful waiting, they'll tell you that it's conversion therapy, even though that is what these countries in Europe are going back to, is this watchful waiting. And there's not an increase in death. There's not an increase in suicides for these kids that are on watchful waiting. But still, these gender ideologues will say that that's conversion therapy and you're putting these children at risk of suicide and death. So you're not getting informed consent. The other thing, and Anne brought this up earlier too, is that children are not developed enough to be able to give consent. The brain does not fully develop until they're about age 25. And you're asking kids that are half that age to give consent to these life-altering procedures that will shorten their life and make the rest of their lives miserable. But the other thing too is that parents theoretically cannot give consent for these procedures either, at least according to a ruling in California, where it said that parents cannot consent to harmful procedures. And I think we would all agree that these are harmful procedures, but that they're not perceived as such by the gender affirming crowd. So, but if you pushed it, you might be able to make some progress in pursuing that. But it's going to be tough because the states that allow gender affirming care are the same ones that have judiciary that also accepts gender affirming care. So you're fighting two heads of the Hydra at the same time. So
what you're saying too, Dr. Allen, as I think about this, is these are healthy children. These are physically healthy children, not mentally healthy, but they're physically healthy. And so doctors and gender clinics are surgically, medicalizing through hormones and with all kinds of, like you said, all of the side effects that come from them. And there's many, many. I talk about that in this next book that's coming in September because people need to understand. But all of those are being applied to healthy bodies. And then we talk about young girls, 13 years old, having double mastectomies, having their healthy breasts removed for absolutely no reason. There is absolutely no reason because, of course, there is nothing that's helping them long term. It's just fulfilling the thoughts, and maybe I will put it out there, a delusion that they are in the wrong body.
Yeah.
And this is such medical malpractice. I can't even begin to articulate how awful this is. And
it is fulfilling the bank accounts of these vile surgeons. Anne.
Are we ever going to be able to see accountability for
Gallagher out of Florida, who got out of Dodge, or maybe still there. Nobody can find her apparently, but owns a yacht, paid cash for this yacht. These surgeons, these diabolical surgeons, are living high off the hog with these kids having skin in the game, so to speak.
Are we ever going to see accountability for this?
Yes.
Oh.
Yeah, there's already lawsuits coming forward. Chloe Cole is probably the most famous. There's another detransitioner that was treated at the same clinic, and I forget her name. There's Bell, I forget her first name, out of the UK.
Kira Bell,
who brought down the Tavistock clinic through her complaints. And every day there's more and more people coming forward saying, this should never have happened to me. These doctors should never have allowed this. My life is miserable now. And so Tom Nugent, is that his name?
Yep. I think Tom. Is it Tom Nugent? Do you know that? I think it's Tom.
But he's, well, she.
Oh, Tom. Okay. Yeah. Oh.
Yeah. So he is very outspoken, and he went through transgender surgeries. Started off as female. His wife, or her wife, was not comfortable being in a lesbian relationship, so he transitioned to being male, and then transitioned back, sort of. I mean, he still looks very male, and he uses both male and female names, but usually goes by his male name, from what I've seen. But he's very outspoken about the harms that have been caused to him.
Oh, Scott. There we go. Scott.
Scott, that's it.
That's right.
Didn't he have, I think, no, correct me here, I think something like 17 reassignment surgeries, like after the reassignment, after the complications. Yeah. Was that him?
I'm not sure how many surgeries he's had. He's had some to redo because he's had issues with the prior surgeries, so infections and things like that. And, he talks about his life being short and talks about not being able to see grandkids grow up and things like that. So back to conversion therapy, talked about that. So scientific credibility, the evidence that they quote for using transgender affirming therapy is based on very poor quality or low quality evidence. And there have been numerous studies that have shown that this evidence is not good. And there have been other studies that show that they're more harm than benefit. So that's why England and Denmark and all these other European countries are pushing back and saying we're not doing the affirming care anymore, and they're going back to the watchful waiting.
So, Dr. Ellen, you just brought up a point that is so important. It's important for people to understand that how a study is conducted, and that's called methodology. So the method that is used, that'll either give you valid and reliable information, data, outcomes, or it's going to be used to prove your point. And I do remember one study was being cited that supposedly the goal was to show that, oh, there's very few regrets. Well, this particular study, the participants were from a WPATH conference, World Professional Association of Transgender Health. So you're asking the foxes that are in the hen house, and only a portion, a very small portion. So in one of these plenaries that I couldn't believe they actually showed their method. So their method was, in a plenary session, they hand a bunch of these surveys out, and very few, just a handful of the physicians that are doing these surgeries. So you're asking a surgeon, have you received any complaints? But so the ones that are doing the study, it's like saying, do you think you should be prosecuted for malpractice? And so that became a study. Oh, there's very few regrets.
What we found, John, what we found and what we're hearing from detransitioners, they don't go back to the surgeon that did the surgery. They're not going back. They're trying to find help elsewhere. Why would you go back?
Surgeons won't give them the time of day.
So there's this
right. They send them home and basically wash your hands. Talk about taking the money and running. Talk about exploiting these kids.
Yeah.
So doctor, as a physician, keep going. This has to drive you nuts. That's why you're here to talk about this.
I've seen Brad go, okay, our time is almost up.
Oh,
well, it is almost up, but something comes to mind as a parent and as a broadcaster sitting here and listening to the three of you for the last hour. These kids, these parents, grandparents need to choose wisely. You need to choose very wisely at this time. You need to make a conscientious decision, not based on emotion, not based on anger, not based on the way you feel today and the way you maybe felt yesterday. Tomorrow you're going to feel different again. So choose wisely. Don't make these mistakes. Don't let this happen to your kids. Talk to your kids. Parenting is the biggest part of this whole thing. You go to a therapist, the therapist is telling your kids to go ahead, we support you, don't talk to your mom and dad. You need to be involved in your kid's life. This is very concerning for not only the doctors who are against this all, but it's very concerning to other parents who are hearing about this and seeing the realities, seeing what these kids are forced, intimidated, coerced, and extorted to be a part of. This is Unmasking the Trans Movement. I'll give you all one last brief moment to depart here today. Let's start with Dr. Ann.
I'll turn my moment over to Dr. Allen because I've said lots.
Yeah, so again, my big concern is that this is conversion therapy that's being approved by all the medical organizations in the United States, where they should be rejecting it just like they do any other type of conversion therapy.
Yep.
And Brad, I'll just encourage people, go to the main, literally the main wire, look up the article, Gender Affirming Care is Conversion Therapy by Dr. Allen. He walks through the points of how, using their own standard of what conversion therapy is, that this meets the standard.
I'm so proud of all of us
so
that
much.
we make an effort here to basically educate and empower and really develop an effort for parents, grandparents, and children alike to stay away, to make a change in the path that they may be going on. This is Unmasking the Trans Movement. Thank you all for being here. Dr. J. Allen, we couldn't have done it without you. Dr. Ann Gillies, thank you again for being here. John, it's always a pleasure to have you on the show. Every time you're here, you bring such fantastic guests and really expose this all for what it truly is compared to the other lies that are out there. I'm Brad Wilder. This is Unmasking the Trans Movement. You can find us online at unmaskingthetransmovement.com. We also have a YouTube channel up that carries all of our episodes. We're on BitChute and Rumble as well. Till next time, remember, it's not our kids' fight, it's our fight. We'll see you soon.